Struggling with weight gain or having irregular periods? Or have you noticed new hair growth on your chin? Or are you planning for pregnancy and there's some issues falling pregnant? So make sure you see your own health professional or see us at www.athenawomensclinic.com.au. I'm Dr. Kavipriya Soma, GP with special interest in women's health. Just want to give you a little gist about what polycystic ovarian syndrome is. So, polycystic ovarian syndrome occurs in most reproductive age group women, but remember, this is not an isolated disease that affects them. It's a continuum, and once diagnosed in a woman, this can continue to progress to lead to diabetes and other cardiometabolic conditions. So it's really important. It is a chronic disease, and it's really important you get yourself investigated and look after yourself for your own better health outcomes and better pregnancy outcomes as well. So what are some of the symptoms? As mentioned before, you can have irregular cycles or irregular periods. Weight gain might be one of the reasons, or despite the best efforts that you're trying to put, but make sure you do put in those efforts of eating healthy and exercising. Otherwise, the weight gain can be quite detrimental to you right from this age group. So it's really important that you start taking good efforts to look after your general health. The other things that you may face is the irregular periods. So first things first, before you visit your doctor, I would recommend that you start noting down your cycles. So your menstrual cycle or menstrual diary is very important for us, so we can analyze what's happening to the cycle. Also noting down along with that, please make sure you note down the amount of blood loss and if there's any pain associated with that. So once you've got this, generally the investigations will be organized by your doctor. Of course, we will look out for other medical features as well, making sure there's no underlying medical conditions that give you similar sort of symptoms. But the basics is the ovary is studded with multiple follicles where it doesn't get released, so leading to the hormonal imbalance. That's why you end up having the irregular cycles. But once you start exercising, this hormonal imbalance gets corrected, the covering of the ovary gets thinned, and ovulation may occur. Although it may take a long time, it is to be done to have better outcomes, as I mentioned before. So the bloods that we normally organize would be your reproductive hormone testing and something called free androgen index, where we assess the SHBG levels as well. Simultaneously, an ultrasound is performed to check on the morphology of the ovary. Now, there are certain strict criteria that has to be followed. So sometimes when we look at young women's ovaries, it may look like they have a polycystic ovary, but they may not have the actual disease. So please don't get confused between the appearance and the disease. They are two different entities, and that has to be discussed with your own healthcare professional. But the basics of treatment, again, as mentioned, you have to exercise. There is no other easy way. Please make exercise your friend. Even if it's your enemy, make it a frenemy, but it has to be done. Once you've done that, there are not many medications unless you're planning to fall pregnant, then you may need reproductive assistance. But generally, lifestyle is the most important thing that gets emphasized and has to be done. So it ultimately, correcting this lies with you. All the best.